in the supplement and the number of pages in the like bound volume. And then when it gets large enough, that's when they suggest it be replaced.
Okay, let's get started.
Yeah. Yes, yeah. Okay, I didn't realize that was in there. I'll look, okay. And maybe we can have dinner next week.
Yeah.
Okay.
Okay, good morning, everyone. I apologize for the technical difficulties. And welcome to the Legislative Committee on Administrative Rules meeting on Thursday, March 16th. We'll start by reviewing the minutes, approving the minutes. I just had a little birdie tell me, do introductions. Okay, I'm out of order. Okay, to my left, we're doing introductions.
Anthony Dexter Cooper from the Office of Legislative Counsel.
And Representative Mark Higley, represent the Orleans Lamoille District.
Chris Bray, representing the Addison Senate District.
Seth Bongartz, I represent Arlington, Manchester, Sandgate, and part of Sunderland.
Carol Odie, I represent part of Burlington.
Mark McDonald, I represent Orange County District.
Representative Trevor Squirrel, representing Underhill and Jericho, and our support folks over here.
Charlene Dindo.
Okay, great. All right, now we're on to the minutes from February 16th. Any edits, comments? Okay, motion, Senator Bray.
I move that we approve the minutes of Thursday, February 16th, 2023.
Second.
Okay, any discussion? All those in favor, please say aye.
Aye.
Opposed? Thank you very much. Okay, we have 4 rules today, and I believe that Ms. Berliner is going to be presenting all 4 of these. So when we start with the first one, which is 22P31, Agency of Human Services, Telehealth. Welcome.
Thank you. For the record, Ashley Berliner, Agency of Human Services. And if it's okay with the committee, I'll start with just an overview of all 4 rules and then get into the individual rules following that, just because we file them all together. And so the public engagement process is the same for all of them.
That's fine with us. We'll vote separately on them all, though.
Of course. So today I am here to speak about 4 amended rules under the Healthcare Administrative Rules Framework: the telehealth rule, prosthetic and orthotic devices, podiatry services, and transplantation services. All of these rules are amendments to reflect current practice, and so there is no economic impact anticipated. The public engagement process for all 4 of these was that prior to rulemaking, the rules were shared with stakeholders, including all of the AHS departments and external.
Excuse me a second. Just a second, Ashley. Can we all understand what she's saying? I'm having difficulty.
Yeah,
You're breaking up. You're not really breaking up, but it's garbled a little bit.
Yeah.
We tried to increase it at this end, but I don't think that's going to solve the problem.
For some reason, Zoom audio is always really weird for me. Let me plug in a different set of headphones. Is this any better?
That's better.
yeah.
You can't hear me at all now, can you?
Yeah, no, it's good.
Ken.
It's good.
We can hear you.
Good.
We can hear you.
Can't hear them.
Here's
You're I will.
Unreal.
means you don't want to hear any of our questions.
Ashley, can you hear us?
Can hear you.
And her voice is
Oh, yeah, it's going on. Yeah.
yeah. We're going backwards.
You could tell her you heard her before. Yeah, it's a good idea.
Okay, can you hear me now?
Yes.
Okay, that was really strange delay. Sorry about that. Do you want me to start over? Or did you catch some of that?
Yeah, why don't you start over?
So for all four of these rules, they were filed under the Healthcare Administrative Rules Framework. There is no anticipated economic impact for any of these rules as the changes reflect current practice. The public engagement for all four of these consisted of stakeholder review from all AHS departments and external partners, including the Medicaid and Exchange Advisory Committee, Vermont Legal Aid, Vermont Medical Society, Vermont Association of Hospitals and Healthcare Systems, Vermont Care Partners, Bi-State Primary Care Association, and the VNAs of Vermont. We held a virtual and in-person public hearing on December 14th. We had no attendees. The public comment period ended on December 21st, and we received one comment from the Vermont Medical Society on the telehealth rule. We considered that comment, but did not make any changes as a result. The comments and the agency response is posted publicly and should be included in your packet. Vermont Medical Society asked that we pay parity for audio only telehealth, which is outside the scope of this rule, so was not addressed under this rule. And they also asked that we remove any diagnosis requirements for telemonitoring, which we are not doing at this time. We did expand telemonitoring diagnosis from just congestive heart failure to also include 2 other diagnoses, which I'll get into as I dive into the rule. But that was the only public comment we received, and no changes were made. We did receive comment from Legislative Council and made changes as a result of that communication, and I will jump into 22P31 now, the telehealth rule. So this was amended to update terminology and come into compliance with Act 6 of the 2021 Vermont legislative session. Can you still hear me all right? Okay, thanks. It updates the term telemonitoring to a more generally used term, remote patient monitoring. And it expands coverage for remote patient monitoring to 2 additional diagnoses, hypertension and diabetes, in addition to the congestive heart failure diagnoses that has been covered since we began remote patient monitoring. It also adds and defines audio only as an allowable service delivery modality in compliance with Act 6 that requires all insurers and Medicaid to cover audio only services as that are medically necessary and clinically appropriate. It additionally clarifies that text, fax, and communication service delivery are non-covered. These modalities can be used to transmit data, but are not covered as a method for service delivery in and of itself. Ledge Council requested changes since we filed the final adopted rule, which are indicated in as adding a term, audio only, to the originating and distant site definitions, and adding nurse practitioners, clinical nurse specialists, or physician assistants as ordering providers for a telemonitoring plan of care. This aligns with their scope of practice and allows them to order services under a plan of care. I'll stop there for questions on the telehealth bill.
Not streaming.